Hey everyone, and welcome to the Bioscan Hub channel. This is your spot for clear, no-nonsense education for medical lab students. Today, we are getting into something that sounds simple but is, and I'm not exaggerating, one of the most critical steps in the entire lab, the proper collection of urine specimens. If you mess this up, nothing else matters. So we're going to break down exactly how to get it right, every single time.
And hey, before we really dive in, if you find this guide valuable, do us a huge favor and hit that subscribe button. It seriously helps us keep making more content like this, and it means you won't miss out on our next explainer.
So here's our game plan for today. We're starting with the basics, the why behind it all. Then we'll get into the different kinds of samples you'll see. After that, we'll talk procedure, the nitty-gritty of how to actually do it. We'll cover the mistakes everyone makes and how to avoid them. Then we'll look at how to keep a sample good, and we'll wrap it all up with what this means for you as a pro. All right, let's start at square one, the foundation. It might seem like the easiest part of the process, but trust me, getting the sample is the most critical step. Think about it. You can have the most advanced million-dollar analyzer in the lab, but if the sample you put in it is bad, the results are worthless, completely useless.
It really is that simple. Garbage in, garbage out. The quality of your result is 100% dependent on the quality of that initial specimen. And that's why giving patients crystal clear instructions and really understanding all the things that can interfere, like foods, drugs, or just simple contamination, is absolutely essential.
Now, here's where it starts to get a little more complex. Not all urine samples are created equal. So let's talk about the different types you'll be working with. More importantly, we're going to see why you have to be a matchmaker, pairing the perfect sample with the perfect test. Which brings up a really good question you might be asking. Why all the hassle? Why can't we just get one sample and run every test on it? Well, the answer is that what's in your urine changes drastically throughout the day. It's not a static thing, it's a dynamic fluid. And this table here really shows you the logic. Let's start with a first morning sample. That's your most concentrated specimen, kind of like strong coffee. It's perfect for finding things that might be in low amounts, which is why we use it for pregnancy tests. A random sample is just what it sounds like. Convenience, collect at any time, great for general screenings. But if you need to know how much of something a person makes in a whole day, like creatinine, you need a timed 24-hour collection. No other way to do it. And for microbiology, a clean catch is king, because you want to test what's in the bladder, not the bacteria living on the skin.
Okay, we've covered the what and the why. Now let's get our hands dirty with the how. We're going to walk through the practical, step-by-step procedures, and we're going to focus on the one that requires the most attention to detail.
Yep, we are zeroing in on the 24-hour timed collection. This is the big one. For any test where the doctor needs to know the total daily output of something, precision is everything. There is zero, and I mean zero, room for error with this one. Now, this 5-step process has to be followed to the letter, so listen up. Step 1, and it's the one most people get wrong, the patient starts by completely emptying their bladder, and they flush that first sample down the toilet. They discard it. The time they do that is the start time. From that exact moment, every single drop for the next 24 hours gets collected. The whole thing ends 24 hours later when they void one last time and add that final sample to the jug. And this quote right here just nails it. The math the lab does to get the final result is based on the total volume of urine produced in exactly 24 hours. So if a patient forgets just one time, maybe in the middle of the night, and flushes, poof, the whole test is invalid. All that time and effort, totally wasted. The result will be falsely low, and that could lead to a wrong diagnosis. So as the professional, your job is way more than just handing someone a jug. In a hospital, make sure one specific person or shift is responsible for the collection. For outpatients, you have to give them instructions both verbally and in writing, because people forget. You need to make sure the exact start and end times are written on that container. And please remind them not to get any toilet paper or feces in the sample. It can really mess with the tests. Okay, let's switch gears. Let's say you get a perfectly collected sample. Great, but you're not out of the woods yet. Now you have to battle two new enemies, contamination and what we call degradation. What happens to the sample after it's in the cup is just as important. I want you to burn this number into your brain. 1 hour. That's the magic number. It's your countdown clock. If you have an unpreserved urine sample just sitting at room temperature, after 1 hour, it starts to change. It's no longer an accurate reflection of what was happening in the patient's body. The sample starts to lie.
Now what you're seeing here, this isn't just a list, it's a cascade of decay. Bacteria that might be present start to multiply like crazy. They eat any glucose in the sample, which could make a diabetic patient look normal. They convert urea to ammonia, which makes the pH spike. This change in pH can actually cause red blood cells and important casts to literally fall apart and disappear. Light destroys bilirubin. You see, the sample you test after an hour is a completely different substance than the one that was collected.
So, how do we stop that countdown clock? How do we prevent this decay and protect the sample? The answer is preservation. Let's look at the right ways to stop that degradation cold.
Your number one tool is simple: refrigeration. Popping it in the fridge slows down almost everything. But for a lot of those 24-hour tests, you need to bring in chemical backup. And it's not a one-size-fits-all solution. As you can see, for calcium, you need a strong acid to keep it from precipitating out. For creatinine, though, just the fridge is fine. And for something super sensitive like porphyrins, you need an alkaline preservative, plus you have to protect it from light. Using the wrong one is just as bad as using nothing at all.
Okay, now this is a huge deal, and it's all about safety. We're talking about giving patients collection jugs that have strong acids in them, like hydrochloric acid. You have an absolute duty to warn them. You have to look them in the eye and say, "This contains a chemical that can burn you. Be very careful. Here's what to do if you spill it." Patient safety is your responsibility. It is paramount.
All right, let's bring it all home. From the first instruction you give the patient to how you handle that sample when it arrives in the lab, your role is absolutely central. You are the guardian of diagnostic accuracy.
So, what are the big things to take away from this? Number 1, your instructions are the first line of defense. Be clear, be thorough. Number 2, don't just memorize steps, understand why you're doing them. Number 3, never guess about preservatives. Always check your lab's procedure manual. Always. Number 4, document everything, the times, any issues, all of it. And finally, and most importantly, put the patient first. Their education and their safety are your top priorities.
So, I'm going to leave you with this question to carry with you. The next time you give instructions for a collection, or the next time a sample cup is handed to you, what will you do to make sure it's flawless? How will you protect that result and, by extension, that patient? Answering that question every single day is what makes you a true professional. Thanks for joining this explainer from BioScan Hub, where we help you master the details that really matter.